Just depression, they said, but it was Lyme disease. This is part of a Common Sense Lyme series. I'm Dr. Cameron. I had a patient who had been to several doctors, and the conclusion was it was probably depression. She knew something was wrong because she had crushing fatigue, joint pain, and brain fog. Her diagnosis became a dead end. The new symptoms that she would experience were dismissed as mental health issues. No one asked about her symptom pattern. No one considered it an infection. The diagnostic lens seemed rather limited. But with different kinds of questions, it turns out the symptoms had migrated. They were worse than anyone expected. There was a broad range that had been going on for weeks and months. She also wasn't getting better with any antidepressants that she had tried. Therapy hadn't helped. Lyme disease tests were ordered, but fortunately they were positive. The diagnosis was Lyme disease. Lyme disease is a problem because you don't always see a tick. In fact, you quite often don't see a tick or a rash, and it can mimic depression, anxiety, chronic fatigue, brain fog. It can also mimic a wide range of mental health disorders, including anxiety issues, panic attacks, bipolar disease, OCD, and PTSD, also just somatic disorder. But fortunately, her energy returned following treatment, her brain fog lifted, the pain improved, her mood stabilized. She felt like herself again. Now, I've had patients where they have depression and Lyme. So sometimes in that case is that I treat the Lyme, a lot of the symptoms improve, but they still have their underlying psychiatric condition. The final takeaway is that mental health labels matter. So you might have a psychiatric problem, and I've seen it where Lyme disease was overlooked. And if Lyme disease is recognized, it certainly makes it easier to feel better, makes it easier to either resolve what was thought to be a psychiatric condition, or if they have a diagnosis of depression, at least it's much easier to manage if the Lyme disease is treated. Thank you for joining me for this Common Sense Lyme series.